detected with prostate enlargement, and what are its common signs and symptoms?
First, we need to know what is a prostate. Prostate is a gland situated on the mouth of bladder. It's a sexual organ basically. What it does, it synthesizes around 75% of the seminal volume. These prostatic secretions, they feed the sperms so that they can be live for around 48 to 72 hours inside the female genital tract. What happens? Everything in the body is controlled by hormones. So when we age, there are changes in the hormones. There is less of testosterone and more of estrogenic effects. That's why there is gradual increase in size of the prostate due to hormonal imbalance. It is a very common phenomenon according to it, and you can tell it as an aging process. One second most important thing is, look, most of more than 75% of the people more than 60 years of age will have some kind of prostatic enlargement. It's what exactly bothers the people, that as it sits on the mouth of the bladder, it usually obstructs the urine flow. That's why the symptoms do occur. And what are the symptoms? How, if somebody comes to you with a report that my prostate size, its normal size is 0 to 25 grams, my prostate size is 30, what should I do? And he is asymptomatic, you do not do anything about it. Then what are the symptoms? Symptoms are mostly urinary symptoms related to urination. Like what are those? First is hesitancy. The person has to wait for 3, 4, 5, 6 seconds before commencing urine output. Second is intermittency. That is, he has to break the urine in between, then pee again, then break the urine in between, then pee again. Third is poor stream. The flow that was before, like 2 years, 3 years before, slowly drops down, and there is a slow stream of urine and a sensation of incomplete emptying. After urinating, the person will feel that some amount of urine has been retained inside the bladder, and there are some irritative symptoms. Irritative symptoms like bladder usually contracts against an obstruction. So what will happen? Bladder will become hyperreflexive or hyperreactive. So there will be frequency. Normal frequency is a person should be able to hold urine for at least 2 to 3 hours. If he voids in less than 2 hours, then it is called frequency. And urgency. Urgency is a compelling desire to void. If you think you have to urinate, you have to rush to the bathroom. Urgency, incontinence, even before reaching the bathroom, patient leaks few drops of urine. That is urgency. Incontinence, urinary incontinence. Then is nocturia. Getting up multiple times at night for urination is nocturia. These are basic symptoms of prostatic enlargement. If someone suffers from these symptoms, then that doesn't mean he will have prostate 100%. There are other causes of such symptoms. But primarily in a man aged more than 50-55 years with these symptoms, prostate is the first differential diagnosis. We think about the prostatic enlargement in that patient.
Thank you so much, sir, for so elaborating, explaining all our queries. We have a few couple of doubts that I would want to clear from you. So as you said that there are these different signs and symptoms that come about, are there any associated pains as well? Do the patients feel pain?
No, normal prostatic enlargement and urinary symptoms, they do not have pain. But pain can occur when there are complications of prostatic enlargement. If somebody has a prostatic enlargement, he's still symptomatic, but he's afraid whether I have to go for surgery. He's reluctant to take medications, and he keeps on living like that. There are certain complications that can happen. According to the complications, there will be symptoms. What are the complications then? First is urinary tract infection. Patient may suffer from urinary tract infection. In between, I'll pause it. And prostate is an organ which is present only in males, not in females. That everybody should, the viewers should also know that it is present only in males, not in females. Then what are then? We'll come back to the complications of prostatic enlargement. First is recurrent urinary tract infection. Recurrent urinary tract, any kind of urinary tract infection will have these symptoms, which I have told already, along with burning in micturition, that is called medically as dysuria, but it is actually burning in micturition, blood in urine with burning, and fever, and a lower abdominal pain, pain in the lower part of the abdomen. These are all associated symptoms along with urinary tract infection. What else can be the complication? Complications: recurrent hematuria, that is blood in urine. You will have blood in urine, you will take medications, it will subside. Then again, you will have blood in urine, that is the second complication. Third is your retention of urine, too much of retention of urine inside the urinary bladder. What it will cause? It can cause hydronephrosis, that is swelling of the kidneys, and increase damage to the kidneys to a bit, so that your creatinine level increases. And the most dreaded, not dreaded, but most significant end stage of prostatic enlargement is acute urinary retention. Acute means that is ekdam se hoga. Acute urinary retention means patient is unable to void. It is acute urinary retention. One sudden moment, patient thinks, feels that he is going to urinate, but he is unable to do. He will rush to a hospital, a catheter will be put. That is end point of prostatic enlargement. That is acute urinary retention. These are the complications. Usually, it is not associated with pain, but with these all complications, patient can have pain.
Thank you so much, sir. That clears our queries. Another thing that you shared was that people, men in the older age, mostly suffer from, prostatic enlargement. And it was seen that more than 60% of males do get enlargement to some varying degrees after the age of 55 to 60 years. So, sir, apart from age being the risk factor, what makes someone more susceptible to getting prostate enlargement in future? Or are there even cases of getting prostate enlargement in their early life, early years?
Yes, there are cases where there has been enlargement of the prostate, and it has not responded to medications. Even we have done surgeries in 40 to 44 years of old age people, but they are very rare. Most common cause is age. Other factors are may be significant, may not be significant, but significant for every disease is like lifestyle, a high BMI, sedentary lifestyle. Diets may have, some papers say diets have a role, and some papers say they do not have a role, but high fat, high protein diet, low fiber diet, less in diets less in antioxidants, लाइक हमें हरी सब्जी वगैरह रेगुलरली खाना पड़ेगा और मीट मच्छी वगैरह कम खाना पड़ेगा, ये तो बॉटम लाइन आप मान लो, ठीक है. एंड हम अगर मोटे हैं, विच हैज बिकम एन एंडेमिक इन ऑल ओवर द वर्ल्ड, obesity has become endemic in all over the world, like it causes diabetes, hypertension, dyslipidemia, metabolic syndrome. Prostatic enlargement can be a part of it. So is prostate cancer, as any other cancer.
Thank you so much, sir. We would dive deep into the ways we can prevent this through diet and lifestyle modification in the later part, in the end. But let us move on to the other aspects, which is, can you please explain the difference between benign prostatic hyperplasia, BPH, as people hear this word a lot, and prostatic cancer? And how do their symptoms and treatments vary? And do these both also have prostate enlargement as one of its symptoms?
Look, one, like your muscle can enlarge when you do exercise, muscle can enlarge when there is a tumor inside the muscle. Prostate is an organ. It can enlarge due to non-cancerous condition that is called a benign. Benign means the basic meaning of benign is non-cancerous. So non-cancerous enlargement of the prostate is called benign prostatic enlargement. In pathologically, we call it benign prostatic hyperplasia. And prostate, as any other organ, can have cancer. That prostate cancer also causes enlargement of the prostate and similar symptoms. Actually, in initial stages, there is no difference in the symptoms of you. Prostate cancer can remain asymptomatic for quite a long period of time. So that's why screening for prostate cancer has come. Like we screen with a serum PSA in men aged more than 54 years. Okay, and in men over 45 years, you have a family history of prostate cancer. Number one. In late stages, along with urinary symptoms and complications of prostatic enlargement, which I've already told, prostate cancer can have certain extra symptoms. Like when it metastasizes to bone, like cancer spreads to bone, it may have some bone pain. If it goes to some other structure like lungs, brain, it can have symptoms of those organs. Like if it goes to your lungs, you can have blood in coughing. It can go to brain and cause your seizures and all, which are rare. Most common metastatic site is your bones. It can goes to the intra-abdominal lymph nodes. There are lymph nodes are small nodule-like structures which are present inside the abdomen throughout our body. If it goes to lymph nodes, then it can compress the drainage of the lower limbs and can have swelling of the legs. Erectile dysfunction is an early marker of prostatic enlargement. A early marker of prostate cancer. In prostate cancer patients, we usually may present with erectile dysfunction. When we do a serum PSA, it comes out to be 10, and we investigate it and find a prostate cancer. These are all basic things which we differentiate. But in initial stages, we do not have any difference in symptoms of prostate cancer, because prostate cancer is an asymptomatic condition in initial stages.
Thank you so much, sir. So now that we are back on the topic of prostate enlargement, and as this is so common in aging men, from what age should men start being more alert or cautious about and start checking up their own health? So after what age should they start getting, themselves checked for any signs of prostate enlargement or anything?
When there is a family history, then we can start checking at at the age of 45. If there is no family history, we can start checking ourselves when we are more than 50. And most importantly, we should know the symptoms. Once we know the symptoms, we will go to a doctor when we get symptoms. According to international guidelines, the screening test for prostate cancer starts at 54. At the age of 54 up to 72, we start screening for prostate cancer with a yearly serum prostate specific antigen, that is shortly called serum PSA study every year. So nowadays that health checkup has become very popular. We are getting patients with increased serum PSA very often, so that we are able to detect some of the prostate cancer which would have metastasized or spreaded to other organs if serum PSA had not been done at a particular point of time. So that is how it is important. One. Number two is patient should be aware of the symptoms. That is very, very important. If they find anything abnormal in their urination, which normally people ignore, they should consult a doctor, so that they will be prescribed some test, and we will know whether he has a prostatic enlargement causing symptoms or not.
Thank you so much, sir. Also, can we talk about what are the different treatment options for prostate enlargement that are there available in India, and how do you determine the most suitable treatment for an individual patient?
Actually, there are different. If we first, doctor, should we go for a diagnosis? Can we go for diagnosis before coming to treatment? How to diagnose a prostatic enlargement causing symptoms?
Yes, sir. Let's start with diagnosis.
Okay. How do we know that there is a prostatic enlargement? First, we have to know that there is a prostatic enlargement. One, we should know that this is a non-cancerous prostatic enlargement. Number two, then we'll go to symptoms. First, patient may come with symptoms. Patient has certain symptoms which I have already told. Many people also know. Then what we do? We advise them 3 tests. One is serum PSA, which should be less than 4. Up to 4 is normal. Then ultrasonography, ultrasound, kidney, ureter, bladder, with pre-void and post-void residual urine. Pre-void means before voiding, how much urine is there in the bladder, and after urinating, how much urine is there inside the bladder. And that ultrasound will tell us precisely what is the prostate size, what is the pre-void volume, what is the post-void residual volume, and is there any abnormality in the kidney, ureter, and bladder due to prostatic enlargement. Another test is uroflowmetry. Uroflowmetry means a patient has to void in a machine, on a machine. That is a uroflowmetry machine, so that the flow curve comes out. These three are basic tests, and after we see these tests, if at all required, we can go for other tests. And kidney function test is usually not advised in international setting, but in Indian setting, we usually do a kidney function test if the patient has not done it, because usually health checkup is very uncommon in nowadays. It is becoming common, but very uncommon in rural part of the India. So after that, we know the prostate size. And if at all there are few other tests which may also be required, like CT scan, MRI, urodynamic study, and cystoscopy, these are all. After that, if the doctor finds that we need further evaluation, then other tests will be done. Then we'll come to the treatment part of the prostate cancer. First message I want to give you that around 30-40% of the people with prostatic enlargement, maybe 50%, do not need any treatment. Some kind of lifestyle modification can delay the commencement of the treatment for 2, 3, 4, 5 years. Number one. Number two is, out of these people who need treatment, 75% of the patients will be stable with medications only. They will be taking one pill a day and they will be stable. And only 25% of the people need surgical intervention. When we come to surgery, we will come to the surgical part. What kind of a lifestyle modification patient has to take? First is restriction of moderation. Actually, it is not restriction. Moderation will be a better word. Moderation of water intake. If the patient is drinking a lot of water, then what happens? He will have to pee multiple times. That's why moderation of water intake. Second is nighttime fluid restriction. Those who are symptomatic, they have to get up multiple times at night. They should restrict the water intake after evening 7 or 8 p.m. 3. A healthy lifestyle, healthy diet is very, very important. Some pelvic floor exercises, like like Vajrasanas, Kegel exercises, these Dhanurasanas, these are all pelvic floor exercises which will strengthen the pelvic floor muscle. And what is the pelvic floor muscle? On which our body, the muscle group on which our body stands is a pelvic floor muscle. The whole of the weight is on the pelvic floor muscle, abdominal weight. Then it will be the persons who have a stronger pelvic floor muscle will be able to hold the urine and reduce the symptoms. This is third. Fourth is reduction in weight. If at all possible, after 60, very difficult to reduce weight, but there are certain ways how you can reduce the weight after 60 also without exercise and doing. That is a different talk altogether. Fifth is dietary modifications. Some diets like tea, coffee, cigarettes, chilies, masalas, what they can do? They have the capability to irritate the bladder. Okay, they have the capability to irritate the bladder and increase the symptoms, those symptoms which are called lower urinary tract symptoms. They have the capability to increase the symptoms. So that's why if somebody drinks 10 to 15 cups of tea or coffee, he has to reduce it. Then sugar control is another thing. Okay, these are the lifestyle modifications which will help us in reducing the symptoms. 1. 2 is then comes to medications. We have medications. One will increase the flow rate by opening up the bladder neck. Those are called alpha blockers. There are 3 types of alpha blockers. According to the patient, we give whichever is very excellent for what patient. And another is dutasteride, which will reduce the prostate size over time. It takes 3 to 6 months to start acting. Definitely, somebody comes with a 50-gram prostate, and you start him on alpha blocker and a dutasteride. After 6 months or 7 months, you see that the prostate size has reduced to 35 grams or something, and the patient symptom has reduced. Alpha blockers dutasteride is not recommended in prostate size more than 30 grams. If the prostate size is more than 30, 30 is actually a very low volume. 25 is normal, 30 is more 5 grams over 25. And if you give, even if you give a dutasteride, it is not going to reduce much. Then that is how it goes. There are some people who will not respond to medications, even if you give medications. Who are those people? Like those who have a median lobe. Some people have inherent receptor changes, so that they will not respond to medication. And there are 5 other conditions in which you have to go for a surgery. 5 other conditions. Patient presents to you with acute urinary retention. Acute urinary retention, you put in a catheter, you start him on alpha blocker, and after 7 to 10 days, you remove the catheter, you see that the patient is not voiding. That is called a refractory retention, and refractory retention needs surgery for the prostate. Second is recurrent urinary tract infection even after taking medication. Patient is having recurrent UTI. What is a recurrent UTI? More than 2 to 3 times a year is called a recurrent UTI. If the patient comes every 1.5 years with a urinary tract infection, you cannot stamp him as recurrent UTI. And there should be if there is recurrent hematuria. If another condition, if there is a bladder stone along with the prostate, if there is a bladder diverticulum is an outpouching of the bladder, those doctors will be able to understand better. If there is a bladder diverticulum, and if there is chronic retention, suppose there is a very high post-void residual urine causing hydroureteral nephrosis, that is storage of water or urine inside the kidney causing increase in serum creatinine, that is you are unable to void properly and your kidneys are getting damaged due to that. Then in those 5 conditions, and the 6th one is if the patient is not responding to medications, then what we do, we advise the patient for surgery. If we advise the patient for surgery, then what are the surgeries? Previously there were open surgeries. Now it is almost open surgeries are not done unless and until prostate size is very, very big, like more than 200 to 50 grams. Nowadays we do a surgery endoscopically. What is endoscopy? Entering into a normal orifice is called endoscopy. In endoscopic prostatic surgery, we enter through the urethra. Urethra is the opening through which we usually urinate. We enter through the urethra, go to the bladder neck, see the prostate, and remove it. How we are going to remove it? First, with normal electric current, there is a cutting loop that will cut chips of prostate, and it will push into the bladder. Then we remove those chips. That is called standard TURP, and that is the gold standard surgery. Second, due to some complications of TURP, another modality has come, that is bipolar. We use we do not use a normal current, that is a bipolar current is being used. The complication rates are slightly lesser. That doesn't mean bipolar is better than monopolar, nothing like that. And number 3, lasers have come up. There are different kinds of lasers with which we endoscopically do a surgery. I am trying to tell the viewers that there are few important things. Number 1, usually there are no cut marks. We do not have to cut anywhere for a prostate surgery. 2, now people will ask whether the whole of the prostate is removed. No, whole of the prostate is removed when we do a surgery for prostate cancer. When we are doing a surgery for benign prostatic enlargement, whole of the prostate is not removed. Part of the prostate which is usually obstructing, that is called the transitional zone of the prostate, is removed. This is standard practice. There is nothing. 3, what all are the complications? Immediately there could be bleeding, there could be infection. Long term, there is a possibility of stricture formation and stress urinary incontinence. Stress urinary incontinence is very rare complication. Stricture means when we enter through a urethra, come out multiple times, there can be blockade at some part of the urethra after surgery. That happens in 10 to 15% patients post prostate surgery. And stress urinary incontinence is a complication in which when the patient strains, there is slight bit of urinary leak after surgery. And second question, what people normally ask is whether there is a chance of regrowth of the prostate. Yes, there are some chances of regrowth of prostate in some patients, but that is pretty rare. Okay. And then why I am trying to discuss the complications, because if you know about the complications, then we'll do a surgery. Just enlargement of the prostate is not an indication for treatment, number one. Now, number two is enlargement of the prostate is not an indication for surgery even. People will come, I have a 70 grams prostate, please operate. So we have to go for a prostate surgery when it is absolutely indicated. One. Two is when surgery, the advantages of surgery are more than disadvantages, then we'll go for surgery. Normally the surgery is not a very big surgery. It is patient has to be hospitalized for a day or two, in fact 2 to 3 days max, and we discharge the patient. And it is a very common surgery done by all urologists across the globe. So we can go for a surgery in prostatic enlargement patient if at all it is recommended.
Thank you so much, sir, for so nicely explaining all the different aspects of prostate enlargement to make us understand that everything that we need to know about this. So most of our audience that watches these kind of health related shows are either having some family member that is suffering from this disease, or are suffering from themselves, or just are simply curious. So those whose family members or themselves are suffering and have been prescribed to go for surgical treatment for this problem, and are feeling hesitant, and are not sure if they, because with old age the family is also very concerned about going under the surgery for any little thing, and they themselves are also very hesitant because they do not know much about it. So what would be your advice on those people?
I'll take a minute. Age is not a bar for surgery. Patient should be fit, and this should be the indication should be absolute. A patient came to me with catheter in place. He was walking. When I asked about his age was 99. Okay. Then the patient was a little bit fit, so I operated on him. He lived for another 6-7 years. He died almost 6 months back. I operated him in 2015 or early 16, late 15. Then he had no urinary trouble. He lived. He died of a cardiac cause. And his grandson is still coming to me with all different kinds of patients, whom to show, whom not to show. Age is not a big criteria. People at the age of 85 who are not going to do surgery. After 2 years, whether the patient is going to be younger? No. Patient is going to be more risky after 1 year. If there is an absolute indication, if the patient is on catheter, then definitely if the patient is anesthesiologically fit, then we have to go for surgery.
Okay, sir. Thank you so much for sharing that. And now that we have come down to the very end of this episode, what would be your key takeaways that you would want our audience, to keep in mind?
First, be aware of the symptoms. Number one. Second, do a health checkup every year and get a serum PSA done every year. 3, you should know that prostate medications are kind of lifetime medications. Don't think that you will take a medication for 15 days, 1 month, 3 months, and you will be able to stop it. No, if you stop, you will have to restart in 15 days or 1 month or after 3 months. 3, prostate enlargement does not always need surgery. And if there is an absolute indication for surgery, then you should go for it.
Thank you so much, sir. With that, we wrap up this show for today. I would like to thank Dr. Biswajit Nanda for taking out time from his busy schedule and imparting us with wealth of knowledge and information all around this topic of prostate enlargement. I hope our audience was made aware of various different aspects around this. And now, as sir has said, you know the symptoms on about this prostate enlargement. So thank you so much.
Thanks, thank you too.
Thank you, sir. I would also like to thank our partner in the activity, JB Chemicals and Pharmaceuticals, for taking up this brilliant initiative for spreading awareness around sexual health care. Thank you so much. And I also thank our audience for staying with us till the very end. With that, we sign off now. Stay happy, stay healthy. Bye-bye. Thank you. Thank you, sir.
Thank you.